Also, though, there's growing concerns over the deadly Hantavirus outbreak now that there are more than a dozen Americans being monitored for that disease. Let's bring in New York City Health Commissioner Dr. Alister Martin now to talk about everything you need to know to stay safe. Dr. Martin, good to see you. Thanks for coming on.
Good to see you, Dan.
Yeah, Commissioner, so let me ask you, because last week we didn't know what Hantavirus was. This morning we're waking up and it's consuming social media. People are kind of worried that it's going to cause another pandemic. This has to deal with rodents, right? New York City, of course, has a lot of rodents. What can you tell us about this?
That's right, Dan. Look, at the end of the day, when it comes to hantavirus, the risk to New Yorkers remains extremely, extremely low, Dan. What we know about this is that Andes virus is a specific type of hantavirus. It's normally found in rodents in certain parts of South America, and it is not found here in the United States. What we also know is that there was a cluster of cases that were identified among passengers of a cruise ship that departed Argentina on April 1st and traveled to Antarctica. And so the risk remains extremely, extremely low. We'll get to some of the passengers in a second, Dan, but the bottom line is none of those individuals were recently here in New York City. And the U.S. passengers who were involved are in a couple of other states, in Arizona, California, Georgia, Texas, Virginia, and none of those passengers have shown any symptoms.
Yeah, but I guess the question is for those passengers who are back on U.S. soil, you know, if people are going to at all compare it to a coronavirus, how does this spread? Because coronavirus was airborne, water droplets, so on and so forth. How does this one spread?
It's a great question, Dan. So what folks need to know about this is that human-to-human transmission of this virus, it can happen, but it's extremely, extremely rare. This is not the kind of virus that transfers through casual contact. The virus only really spreads through prolonged, close contact with an infected person, and it's not similar to how things like influenza might spread or COVID might spread, which is through casual contact or through respiratory droplets.
The World Health Organization also emphatically saying this is not like COVID, but can you explain how bad conditions would need to be in order for people to be infected by the hantavirus here at home?
Yeah, it's a really good question. Well, first, again, really the transmission pattern of this is so dissimilar from things like influenza and COVID, where in those cases, casual contact can cause the spread, or respiratory droplets can cause the spread. But in this case, we agree with the WHO assessment that the global public health risk is extremely low.
Okay, that is good information here. Symptoms, though, of course, mimic what, like flu and cold?
That's exactly right, Dan. So you're going to be experiencing things like flu symptoms, cold symptoms, but we also know that when hantavirus infects folks, things escalate quickly. And so the way that we typically think about treatment is identifying it early and getting folks into supportive care, often involving intensive care unit measures.
Do we know anything about the quarantine phase? Like how long do you have to be observed before you can be kind of let out into general public?
Yeah, well, what we know about the individuals who have been exposed so far, again, there are 8 cases who have been exposed on that cruise ship. 5 of those confirmed cases, and then 3 of those individuals have sadly passed away. What we know is that if there were more folks who were exposed and who were ill, we would have known at this point. Now, at the same time, we are continuing to monitor this very, very closely.
Yeah.
We're working across the country with our public health partners and across the world, quite frankly. This was an international ship with international travelers. And so we're working all across the country with our public health partners to make sure that we continue to monitor this very closely.
Okay, well, I'm glad there's no cases here in New York City yet.
Right.
Let's talk about the other big thing, and that's Legionella. It's summertime. We often talk about Legionella outbreaks because of these cooling towers, which is why there's new requirements in effect today, Commissioner. So walk us through some of these new rules. That's
right, Dan. So look, at the end of the day, we are taking the already nation-leading Legionella protective measures up another notch. New York City is strengthening one of the nation's most protective Legionella laws. Starting today, what you're going to be able to expect is that building owners are going to be moving from quarterly testing of their cooling towers to now monthly testing. So every 31 days, when that tower is in use, Stan, we want building owners testing those samples and getting a sense of whether or not there's Legionella in those cooling towers. This is going to give us the opportunity to respond to problems earlier, to intervene faster, and to reduce the risk of any community spread.
Right, Commissioner, we know we have a lot of big buildings in our area. So how will these building owners be held responsible for meeting these new testing guidelines?
Yeah. So luckily we have, because of that new local law and because of the new budgetary increase, we've got a whole suite of new resources that we can push out there to make sure that we're staying on top of any potential Legionella outbreaks. We've got new water ecologists that add to our tower inspection staff who can go out there and continue that maintenance, continue that those inspective processes. We also have new community engagement staff who can be out there on the ground where Legionella is often impacting communities like in Harlem, like in the South Bronx, to make sure that folks know the risks, know the symptoms, and know the available resources they have for them.
All good information there. Commissioner Dr. Martin, thank you for coming on as always. Good to talk to you. It's the warmer weather, so where's the quarter zip sweater?
Dan, you know, I'm in the summer look now.
Summer look?
So you know, we're in the transition season, so we're going to see what the full summer look is, but the staff has told me no quarter zips.
Oh, gotcha. Okay. All right. Put them all away. They go into we'll see them in the fall. Commissioner, good to see you as always. Thanks for coming on. Good information.
Thank you. Take care.